Hello. Hi, my name is Storm. I'm a student nurse.
Hi, my name is Josh. I'm also a student nurse taking care of your mom.
Is everything all right?
I don't know what's going on. Like, did my mom catch dementia from someone? Like, look how she's acting right now. This is not like her at all.
Nurse, who is this woman in my room?
I'm your daughter, Mom. Like, she doesn't even recognize who I am.
Is it okay if we talk about your mom's condition?
Yes, that would be helpful for me.
Okay, I will just take care of Mrs. Ridley while Josh will talk to you. Everything all right?
Mrs. Ridley has been acting up recently, doesn't participate in activities, and doesn't recognize her daughter. Upon chart review, Mrs. Ridley has no previous cognitive deficits and always attended recreational events. In addition, staff members notice Mrs. Ridley is having difficulty voiding urine. Based on these signs and symptoms, Mrs. Ridley is experiencing delirium due to a UTI.
Hi, Jane. My name is Josh. I'm one of the student nurses taking care of your mother. You sound concerned about your mother's condition. Is this correct?
Yes, my mother doesn't recognize me and has not been acting like her usual self. I am worried she caught dementia from someone.
Jane, I know it is hard for you to see your mother this way. I want to assure you that your mother does not have dementia. She's experiencing something called delirium. I brought this pamphlet for you to look over while we discuss what exactly delirium is and what can cause it.
I am relieved to know my mother does not have dementia. What is delirium?
So delirium is a temporary altered mental state that causes confusion brought upon by one or more contributing factors such as a medical illness, medications, or the environment.
What has caused my mother to develop delirium?
So if you take a look at this paper, multiple things can cause delirium such as infections, drug and alcohol intoxication, medical conditions, or environmental changes. In your mother's case, we believe she has a urinary tract infection. She has recently been having difficulty voiding. We have sent a urine sample to the lab this morning to confirm this, and have started a course of antibiotics to help clear that infection.
Is delirium something that is permanent?
Delirium is temporary, and your mom will be back to her usual self once the infection is resolved. Because of your mom's age, older adults are more at risk for developing delirium because they have decreased sensory impairment such as a decreased thirst sensation.
Okay, this is helpful to know and I feel more relieved.
I'm also going to go over the common signs and symptoms of delirium with you so that you'll be able to recognize them.
For sure.
Alright, so the 5 common symptoms of delirium I want you to be aware of are sudden confusion, changes in mental state, agitation, hallucinations, and disorientation.
Oh, it all makes sense now why my mom is acting strange and doesn't recognize who I am.
Do you have any other questions?
No.
Okay. Alright. So I know we have covered a lot of new information today. I want to be sure that you fully understand. Can you tell me your understanding of what delirium is?
Delirium is a temporary mental state that was caused by my mother's UTI. I understand that due to her older age, she's more at risk of developing delirium.
That's correct. Can you tell me the 5 signs and symptoms that are present when someone is experiencing delirium?
The 5 signs and symptoms of delirium are sudden confusion, changes in mental state, agitation, hallucination, and disorientation.
Perfect. Do you have any more questions or concerns regarding delirium or your mom's condition?
No, I now fully understand why my mom is acting like this. I really appreciate you explaining this information to me, and it has relieved my worries knowing this is temporary.